Chris Ersman. And following Chris, we'll hear from Lindsay Kruger, the Director of the MDH Office of Health Facility Complaints. We'll also hear from Kathy Merkel, whose mother is a resident in a long-term care facility in Minnesota. Kathy is spelled K-A-T-H-Y, and Merkel is M-E-R-K-E-L. I'll also mention that we have MDH Assistant Commissioner Marie Dotseth on the line to help us during the Q&A. After the opening statements, we will open it up for questions from reporters on the line, but first, let me turn it over to Chris Ersman.
Thank you, Mike. Let me start with a situation update. Globally today, we were at 27.8 million cases and 904,000 deaths. In the United States, we were at more than 6.3 million cases and 190,000 deaths. In Minnesota, we added 389 cases yesterday for a total of 82,249 cases. Our median age of cases is 35 years old. We added 15 deaths yesterday for a new total of 1,884 deaths. 11 of these deaths occurred in residents of long-term care facilities. 3 were in Dakota County, 2 each in Crow Wing, Ramsey, and Waseca counties, and 1 each in Carver, Hennepin, Knabec, Nicollet, Olmsted, and St. Louis counties. The total includes an individual in their hundreds, 4 in their 90s, 6 in their 80s, 1 in their 70s, 1 in their 60s, and 2 in their 50s. There are 257 patients currently hospitalized and 138 in intensive care. I'd like to provide you with a testing update. 4,572 total lab tests were reported today, a decrease from yesterday's 5,373. We're still likely seeing depressed numbers from over the holiday weekend. The 7-day average testing positivity rate is 5.3%. which is slightly lower than the week prior at 5.4%. It's interesting to note that New York, which has a rate of less than 1%, just this week has started to allow indoor dining in restaurants at 25% capacity. The 7-day average weekly change in testing is 5.7% compared to 6.4% the day before and 8.2% the week before. Testing is increasing by 5.7%, and new cases are increasing by 5.3%. I'd like to provide a couple of updates on some outbreak situations. We've often been asked about cases associated with a wedding in Lyon County. We are currently at 75 cases associated with that event, including 1 hospitalization. We've seen cases in 14 counties that attended that event. The median age of the cases is 25, and the range is from 10 to 84. We are aware that many of the individuals who attended the event and have developed COVID work in healthcare and education, but we have not yet identified secondary spread. And while we've seen many cases associated with restaurants and bars, this is the largest social event in terms of the number of cases identified. So it's not necessarily that there was a single super spreader, but just simply that this is the largest event that we've seen pertaining to disease transmission for a social event. And then I'd just like to give a couple of updates related to long-term care, since that is the focus of today's conversation. There were 20 new long-term care facilities that reported cases for a total of 1,763 long-term care facilities with positive cases. We added 47 new cases yesterday, which was down from the 58 the day before. 19 of those were residents and 28 were healthcare workers. And I just want to comment that over time, what we've seen is that a much larger proportion of our cases are occurring in healthcare workers rather than residents, and that really is a function of the increasing community spread that we're seeing. Overall, 73% of facilities, or 1,238 of 1,688 facilities, have not had any new cases in the last 28 days, which is similar to what we had seen yesterday. So with that overview, I'd like to turn it over to Director Lindsay Kruger.
Thank you, Chris. Good afternoon. Today, we will be giving an update on long-term care settings and our essential caregiver guidance. But first, I wanted to start by providing some data on MDH licensed long-term care settings during COVID. As Chris mentioned, she had gave some specific data regarding facility numbers. Regarding nursing homes, 67% of nursing homes have had an outbreak. 31% of assisted living type facilities have had an outbreak. Right now, currently we have 39.4% of skilled nursing with one or more cases, and 10.34% of assisted living type facilities that do have one or more cases at this time. Looking specifically at COVID deaths since April, we have seen a significant difference over a 5-month time span. In April of 2020, the total percentage of Minnesota deaths that resided in a nursing home or assisted living type facility was at 84.2%. In May, that decreased down to 79.9%. In June, 68.6%. In July, 57.3%. And in August, the total percentage of Minnesota deaths that resided in a nursing home or assisted living type facility is at 52.1%. I wanted to highlight this data today because it is a great success to mention. This progress hasn't happened by accident. There has been some great work taking place in facilities by administrators, staff, and by a host of partners at the state and local level. The focus and structure provided by Governor Walz's 5-point battle plan really helped focus that energy in the areas where it has made a big impact. Infection control, personal protective equipment supplies, critical staffing support, among other areas. COVID-19 safety with the well-being of residents is a key priority. The goal is to maximize the health and the well-being of residents in long-term care facilities. We know and understand that visitation for residents and families is very important for well-being. We have put out guidance on window visits, outdoor visitation, essential caregiver, and our long-term care visitation and activities guidance to provide options and ways that visitation in these settings can happen safely. We also want to remind that as much as we hope to return to our more normal practices, there are times and situations in which facilities cannot do so. The guidance that we have put out is that guidance. It is not a requirement for facilities to implement. Facilities have many factors to consider when making decisions regarding their individual settings. We do hope that facilities monitor very carefully and allow more visitation when they safely can do so. Today, we want to highlight more about our essential caregiver guidance. This guidance went into effect on July 25th of 2020. While it is not a requirement for facilities to notify the Department of Health that they are implementing the program, we did generate a voluntary survey of the long-term care facilities to gather further data and information on the implementation of the guidance. As a reminder, an essential caregiver could be a family member, outside caregiver, friend, or volunteer who has previously actively engaged with a resident or is committed to providing companionship or assistance with activities of daily living for the resident. Residents can have more than one essential caregiver for providing emotional support and individualized person-centered care. Residents who can benefit from having an essential caregiver include those who struggle with using technology, who are on hospice, who have dementia, who have cultural language barriers, or who have not been able to do an outdoor visit. However, Minnesota Department of Health continues to encourage essential caregivers for all residents. We understand that the essential caregiver guidance does not include all visitors who may wish to visit, who may not meet the guidelines for an essential caregiver. We are happy to have in place the window visitation guidance, the outdoor visitation guidance, and our broader visitation and activities guidance for the more casual visits and other visitors. From the voluntary survey that we did on essential caregivers, 380 long-term care facilities participated in our survey. 137 of them were nursing homes, 187 were home care providers or assisted living type facilities, and 56 of them were campuses with both nursing homes and assisted living type facilities. Of those who answered the survey, 68% stated that they have implemented the essential caregiver guidance, which means 127 nursing homes and 171 home care providers or assisted living type providers have implemented the guidance. Facilities who have not implemented, which made up 53% of those taking the survey, indicated one reason being the COVID risk by an essential caregiver entering the facility. To date, we have not had any COVID-19 cases in a long-term care facility from an essential caregiver. While there have been no cases of COVID due to essential caregivers, we know it's something the long-term care directors and management staff are concerned about. As the community spread increases, we need to be thoughtful about people coming into and out of these facilities. We know that the biggest threat right now is from healthcare workers themselves bringing in cases of COVID-19. It's understandable the long-term care settings would have concerns about opening themselves up to more of that threat. Of those who have not implemented, just over half indicate they intend to do so in the future coming months. The most vulnerable populations live in long-term care facilities. It is important that anyone entering these facilities follow strict and current infection prevention and control practices. The health and well-being of the vulnerable adults and the staff who work in these facilities depend on the visitors to consistently follow these practices. Thank you to the facilities who have been implementing this program and who have worked really hard to follow the screening procedures, the personal protective equipment requirements, and the infection control practices for the benefit of the staff and the residents in the facility. Before I turn it over to Mrs. Merkel to tell her story on essential caregivers, I do want to mention a couple of more points. If you are interested in the essential caregiver guidance, I encourage you to visit the Minnesota Department of Health COVID-19 webpage on long-term care. You can read about essential caregivers and what guidance is set forth for the facilities and caregivers. As a reminder, not all facilities are implementing essential caregiver guidance at this time, and each facility may be different. Facilities are working very hard to keep the residents and staff in their setting safe. They have many facility and community factors to consider when determining what is best for their facility at this time. This is a very tough balance to make. If you are a facility who has not implemented essential caregiver guidance, but are thinking of doing so in the future, the facilities who have been successful with the guidance indicated that it is good to have a clear planning up front, to start slow, and to not be afraid to reinforce best practices. But that the value of implementing this guidance is very clear to the residents who benefit from the essential caregiver visits. And one last point I'd like to make, Chris and her team have talked a lot about the community transmission and their concerns about how the rate of community transmission remains high in Minnesota. They've discussed how this puts schools, long-term care facilities, and businesses at greater risk of impact, and we would also like to echo that concern. As Chris mentioned earlier, the 7-day average testing positivity rate in the community is 5.3%, slightly lower than the week prior at 5.4%. The progress we've made in long-term care is real, but it is also fragile. And even the best run facility with the strongest and most consistent infection control practices cannot withstand a blizzard of COVID in the community that surrounds it. It's up to all of us to bring that transmission rate down by following the guidance we heard last week from Dr. Birx, the White House COVID advisor who visited Minnesota last week. That includes the 3 pillars of COVID prevention: social distancing, masking up, and avoiding crowds. And now I'd like to turn it over to Kathy Merkel. Kathy, please go ahead.
Thank you, Lindsay. Good afternoon, everyone. I'm Kathy Merkel from Virginia, Minnesota, and I'm here today to share our important story about our mother, June Merkel, and the long-term care visitation. First of all, I want to take this opportunity to express how excited and appreciative we are that the Minnesota Department of Health announced on Monday, August 10th, the new visitation guidance as an urgent priority to ensure healthy social and emotional connections with family and friends during the ongoing pandemic to take effect on August 29th, 2020. It was 4 months and it seemed like forever since my brother and I had visited my mother, June Begich Merkel, in person. It was on March 17th that the state had closed healthcare facilities to the public in light of the spread of COVID-19. My brother Greg and I would no longer be able to visit in person with our wonderful mother, a resident since 2010 at Waterview Pines, Virginia, where we had visited her daily since her admission 10 years ago. I remember when the nursing home administrator and director of nursing announced the restrictions to me. I was devastated and hid in Mom's restroom for 1 hour crying by myself. When I came out, I still had tears in my eyes, and Mom started to cry. Then we both looked into each other's eyes and we laughed. I called my brother Greg at work to share the heartbreaking news. Little did we know that we would not meet again in person, inside, until July 24th, 2020, 4 months later. Being outside in the 40-degree or 85-degree humid weather was a challenge. Mom gets sundowners, restless, agitation, irritability, or confusion that begins or worsens as the daylight begins to fade. In the late afternoon, and would cry out, "Come in, you can come in," inside my room. We'd attempt to explain that we can't wait, we must visit outside, but can't come in because of the coronavirus. It was hurtful not to see our mom in person, and she didn't understand why. Waterview Pines, operated by Monarch, the Minnesota Department of Health, and the Center for Disease Control, imposed rules on how families could interact and communicate with residents in light of the spread of the coronavirus. Our mother suffered unintended consequences during isolation. Isolation and loneliness caused our mom to call us at 2:30 or 6 a.m. in the morning. She'd say, "Come and get me. I want to go home. And this had never happened prior to the coronavirus, COVID-19. On Friday, July 10th, when the Minnesota Department of Health announced the potential for loosening the long-term care facility visitation for essential caregivers, I cried. This time, tears of joy and gratitude. My brother and I had an active presence and played a critical role in our mother's caregiving before COVID-19. We made sure she ate at every meal, combed her hair, exercised with her, trimmed her fingernails, walked her with assistance, and even helped with transfers after training and being approved by physical therapy. Now we were spectators in our mom's life through the nursing home window panes. Then on July 24th, state restrictions began to ease. I was allowed a 30-minute essential caregiver visit. I saw my mom sitting in the hallway with a food tray in front of her, and I said, "Hi, Mama." She looked up from her cranberry juice and said, "Hi, Dolly." Macy Blaine, a regional ombudsman from the Office of Ombudsman for Long-Term Care, helped to influence the July 10th Minnesota Department of Health long-term care facility guidance, even suggesting, with mom in mind, that the facilities include more than one essential caregiver in the residents' visits. She has been an angel and was a part of a priceless gift to open the doors to visit our mom in person again. On July 23rd, Juliana Lundberg, the Waterview Pines Monarch Healthcare Management Administrator, did approve my brother Greg and me as our mom's essential caregiver. Yay! Lundberg had outlined the requirements: training, wearing masks and goggles, having temperatures taken, using hand sanitizer, and filling out health questionnaires at each visit. We were given the gift of a 3-hour visitation a day, all at one time or breaking up in different increments. Only one of us could visit at a time. We could go directly to mom's room, although I was given permission to say hello to residents and staff and wave to them in the hallway. Fast forward to the afternoon of August 24th. Life changes in an instant. I was so excited to finally get inside the facility and see our mom and help with cares. And now this virus has reared its ugly head. Our critical visits have been suspended again due to COVID cases at the facility for no less than possibly 28 days. Connections matter. Our mother needs us. Her well-being and quality of life are critical. We're hopeful and grateful to have more upcoming visitation and greatly appreciate and thank the Office of Ombudsman, the Minnesota Health Department, Monarch Healthcare Management, Waterview Pines, and God for allowing us back safely into our mom's home. Thank you.
Thank you, Kathy. Operator, we are now ready to take questions.
Sure, sir. As a reminder, to ask a question, you will need to press *1 on your telephone keypad and wait for your name to be announced. Your first question comes from the line of Matt Sepik with Minnesota Public Radio News. Your line is now open.
Hi there, Chris. I'm wondering if you have any evidence yet of possible infections related to the Labor Day weekend. I know we're only a few days out from that now, but any preliminary figures on that yet?
No, we generally, the most common time that we would see cases be reported, occur would be 5 to 7 days after an exposure. And so we're just barely out that far, not even from the holiday. And so it'll take us a little bit longer first to see cases in their usual time frame. And remember, the incubation period is a full 14 days, and then also for the individuals to get tested and reported. So we'll obviously be watching for that because we were very concerned about all of the potential social activity. But at this point, it's too soon after the event to really be seeing any cases reported to us.
And I know you had been following the results of the people who had gone to Sturgis. Any new figures on that? And do you have any more concrete evidence of secondary transmission related to the Sturgis motorcycle rally?
We are currently still at the 51 cases, 3 hospitalizations, and 1 death. And we are looking at secondary and tertiary transmission. And just so that people are aware, what we mean by that is obviously primary transmission would be attending the event yourself and becoming exposed and developing infection. A secondary would be that you did not attend the event yourself, but you were exposed to someone who did and was infectious. And tertiary would be that you didn't attend the event yourself, but you were exposed to someone who was exposed to someone who did attend the event. And we are looking into cases of both secondary and tertiary transmission at this point.
Okay, but no numbers in terms of secondary and tertiary that you have?
No, not yet. Not more than a handful, but we're not at the point where I could say with confidence the exact numbers.
Okay, thanks, Chris.
Yep.
Your next question comes from the line of Brian Arola with Mankato Pre-Press. Your line is now open.
Hello, and thank you for taking my question. With Mankato's testing days, last week's mass testing events resulting in about a 2.5% positivity rate, how do those rates or results compare to other mass testing events across the state?
Brian, what we've seen is that many of the mass testing events have had, overall kind of a lower rate of positivity, and it really varies by site. But we've also seen that within the event that there have been certain populations in which the test positivity rate is much higher. So I would say that overall the Mankato rate of 2.5% is, slightly more than we've seen in some of the other sites. But I have not seen the breakdown by some of the various racial, ethnic, and age groups. And so I can't comment on how similar or different the data are as it relates to that.
Okay, then as a follow-up, just wondering what more, if anything, do you feel that rate or those results tell us about how much the virus is circulating in the Mankato area?
Well, I think that on a positive note, the fact that the positivity rate is lower than what we're seeing overall for the whole state, I think that's a good thing. We want to make sure that we're looking at what populations may be more particularly affected. And certainly we know that we've seen cases associated with Minnesota State University Mankato. And so we'll be continuing to work with that institution. So we'll be looking, we're looking at if there are any particular pockets, but I think overall, the rate that we saw was a positive thing. We weren't seeing incredibly high rates of positivity in the community, and that's a good thing.
Okay, thank you.
Your next question comes from the line of Catherine Wickert with Minnesota Public Radio. Your line is now open.
So a lot of my questions have already been answered today, but I will ask about schools. I know, we're only now kind of 2 weeks into this. Have you seen any additional cases associated with schools, any trends or anything notable as we go into the second week here?
Well, thankfully, I would say that, we've talked about the fact that we had seen cases that were associated with the learning setting as teachers and educators are coming back, preparing. And so we saw some evidence of cases there. And I would say that we're continuing to monitor what's going on, but we have not had any large issues of concern at this point with the first couple of days of school.
So just to be clear, we saw some delays or moves to distance learning before the school year even started, but you haven't seen any similar decisions made since school started.
Correct. And just to be clear that, the decisions about changing a learning model really have to do with multiple factors. And once the learning model has been established, yes, it's really important to look at what's going on at the level of the county. But more than that, it's important to look at what's going on within the school setting. And so, no, there has not been a situation at this point where that has been discussed.
Okay, thank you.
Your next question comes from the line of Chris Rogers with Winona Post. Your line is now open.
Hi, Director Erisman. A little background for my question. My local public health department took over contact tracing from the MDH in May when MDH was overwhelmed with cases. And now just the opposite has happened. My local health department is overwhelmed and the MDH is helping it. My question is, how is MDH doing on its contact tracing capacity, timeliness, and success rate for reaching people?
Thanks. That's a great question. Actually, we're doing quite well. We have added a number of staff to assist with the case investigations and contact tracing. And for that reason, we are able to help our local public health partners, particularly when they get in a situation as is what's happening with Winona, where you have sort of an explosion of cases in a short amount of time. But our turnaround continues to be within a day. So once we get information and a report on a case, that we have reached out to that individual within a day. Now, the challenge and the message that we want to make sure that the public hears is it's really important that when we do call, that people answer. We can report on when we are reaching out and we are making those efforts. If people don't pick up their phone, that's a challenge. And one of the more recent challenges that we're facing is that we're seeing that some individuals are not responding and not, answering the call, and they are reluctant to provide information about their activities. And both of those things are problematic simply because it's only when we identify where cases are occurring that we can take public health action to limit additional spread.
Thank you.
Your next question comes from the line of James Walsh with Star Tribune. Your line is now open.
Hi, thanks for taking my question. I appreciate it. Real quick, can I get those numbers again regarding long-term care facilities? Did I hear someone say that there have been no cases where COVID was transmitted because of a staff member to a resident?
Oh, no, I don't think we said that. Lindsay,
Okay.
why don't you clarify the information on essential caregivers?
That'd be great, thank you.
Yeah. So the information provided was that there has not been any COVID-19 cases in a long-term care facility that was brought in by an essential caregiver.
That were brought in by an essential caregiver. Okay, gotcha.
And just to clarify, essential caregivers, although they have the term caregiver, that is not a healthcare worker. That is a friend or family member who is providing services to assist the resident. So just to clarify, I can understand why you might have gotten confused.
Yeah, thank you. I appreciate that. But I guess a quick follow-up question then. So is my understanding now that how many essential caregivers are then allowed to visit a family member in the facility now?
And Lindsay, I don't know if we have that exact information, but if you want to kind of reiterate what we do know.
Sure. So we don't have that exact information because the facilities don't need to provide us with them moving to or implementing the policy of an essential caregiver. But from the voluntary survey that we did put out about the middle of August, from those that responded, we know that 127 nursing homes have implemented, and 171 home care providers or assisted living type facilities have implemented the essential caregiver guidance. And that's just of those who filled out their survey. There could be others who have implemented that did not provide that information and did not fill out the survey.
Okay, great. Thank you very much.
As a reminder, to ask a question, you will need to press star 1 on your telephone keypad. Your next question comes from the line of Paul Scott with Foreign News Service. Your line is now open.
Hi, I wanted to follow up on a note in this big paper that just came out that called Sturgis the super spreader event. They had tracked cell phone data to find out where people who left Sturgis went. And they listed in Minnesota, Anoka and Hennepin County as among some of the largest inflow counties in the country. I'm wondering if that lines up with any of your contact tracing. Did people who came from Sturgis seem to come from Anoka and Hennepin County mostly?
I will double check. We'll have to get that for you to see particular counties. We have had 51 individuals with COVID who reported attending Sturgis. And and certainly, as I acknowledged earlier, we're also looking at, secondary and tertiary spread. So certainly our experience in Minnesota has been that we have seen the effects of transmission from Sturgis. And, while those are two very populous counties, which we would say would have a greater likelihood of having someone who attended just simply because they're larger, I think it's important to note that these events impact communities, across the state and across the country. So not just urban areas, but I'll certainly check and see if we have any more granular data that we can give you on Anoka and Hennepin.
Thanks a lot.
Your next question comes from the line of Chris Rogers with Anonymous Host. Your line is now open.
Hi, is the MDH going to report cases by college at all?
We are currently working with colleges and universities and the Office of Higher Education we're working to monitor and establish kind of a dashboard for what's going on in those institutions. But we do also ask the institutions to report what they are seeing, on their campuses. I think one of the challenges is that when we have reported cases that are associated with an institution, it's because the case has some connection to the institution, but oftentimes the source of exposure is not on campus, but rather external social events. But then the individual has, as I said, that connection to the campus. So I think that's one thing to keep in mind as we're looking at numbers. And I don't know if you were on the call yesterday, I updated that we were at 236 cases associated with Winona State, and that was what they are reporting out.
I did hear that. Thank you.
Okay.
Operator, we have time for one more question.
Sure, sir. You have a follow-up question from James Walsh with Stars Tribune. Your line's now open.
Hi, thank you. Sorry about it again. Is Kathy Merkel still there?
Yes, I'm here.
Yes, Kathy,
Hi,
go ahead.
Kathy. If you don't mind if I ask a follow-up question for you. So when were you and your brother Greg able to see your mother as essential caregivers?
We were able to see our mother as essential caregivers on July 24th.
And you were able to see her until when? You said kind of recently, right?
Yes, unfortunately, on August 24th, we did have positive COVID case in the facility, and rear to sadly So now we're back outside at the window pane.
Oh, boy. And that's the way it is right now for you? You haven't been able to see her in person since?
Oh, and it's really hard. She doesn't understand and she's crying out again. So we're hopeful for better days ahead.
And I'm sorry, one last question. Where is the facility located?
The facility is located in Virginia, Minnesota, Waterview Pines, owned by Monarch Healthcare Management.
Waterview Pines in Virginia. Great. Thank you very much, Kathy.
You're very welcome.
All right, that is all the time we have for today's call. I want to do a special thank you to Kathy Merkel for joining us and to all our other guests. If you have any other questions for us, please feel free to reach out to the MDH Communications Office this afternoon. Have a good day, and we will be back with you again on Monday.
That was state health leaders giving the latest information on their response to COVID-19.